Welcome again, students. So our next demonstration is about sacrum. The sacrum is a large triangular fusion of 5 vertebrae, and it forms the posterior-superior wall of the pelvic cavity. It is wedged between two hip bones on the sides, which join to the sacrum on both the sides, and hence these 3 bones complete the pelvis. It is roughly triangular in the shape, with this apex directed downwards where it articulates with the coccygeal vertebra, and its superior end is called the base. It is wide, and this is where the 5th lumbar vertebra articulates with this one. So the 5th lumbar vertebra is articulated at an angle of almost 30 degrees to the horizontal. So in its natural position, the sacrum does not lie vertically like this. It is at an angle with its anterior surface facing inferiorly while it is in the anatomical position. So it is set obliquely and it's curved longitudinally. Its surfaces are as follows. This is its anterior or the pelvic surface. This is its posterior or the dorsal surface, and this is its superior surface at the level of the at the level of base. So its base, here you can see, so this is the first sacral vertebra. On its anterior surface you can see these ridges demarcating one sacral unit from the other. So if I count them, it's 1, 2, 3, 4, 5. So 5 sacral units joining with each other, and this becomes the vertebra S1. So this is the topmost sacral vertebra, and these are its transverse processes. So now that you know about each and every vertebra, there are costal and transverse processes. In the case of sacrum, both the costal and the transverse processes are fused with each other. Costal and the transverse elements are fused with each other. So when you see it on the top, this is called as the ala of the sacrum. Ala meaning the wing. So this is formed from the fusion of the costal elements in its anterior half and the transverse element in its posterior half. So the upper surface of the first sacral vertebra, it's least modified from a typical vertebral plan. The body is still there. It is transversely wide compared to its anterior-posterior width. And this extended edge, when you will look at from the side, this extended edge is called as the promontory of the sacrum. And posterior to it is the triangular sacral foramen. So this vertebral foramen is triangular, and on the dorsal side you can also see the articulating facets of the S1 vertebra. They are meant for articulating with the inferior articular processes of the L5 vertebra on it. तो यहाँ L5 vertebra के साथ fuse करने के लिए ये present है. Inferior to this, you will not see any other articulating facets. They will only be present at the level of the S1 vertebra. So these superior articular processes are going to project cranially, and their concave articular facets are directed posterior-medially. So the posterior part of these processes is going to extend backwards, and like you remember the mammillary processes in the lumbar vertebra, we also have the mammillary process like extension from the articular facets of the S1 as well. So as I told you, the transverse process is very much modified, and it's a broad sloping mass. It is going to project to both the sides. It is called as the ala of the sacrum. As you know about the whole vertebral column, there are anterior and posterior longitudinal ligaments. This S1 vertebra is the level where the anterior and the posterior longitudinal ligaments are going to attach to the vertebral body, and this is where their termination occurs. At the level of the sacrum, the spinal cord is not there, as you know that it ends at the junction of L1, L2. So this is the region where you only have spinal nerves and some filum terminale and cauda equina. At this level, you will not have spinal cord. So the ala are smooth superiorly, they are concave medially, and they are rough laterally. And for the entire extent, this area is covered by the psoas major. There are some important relations here as well. The lumbosacral part of the sympathetic chain is going to travel anterior to the sacrum, almost in the midline. So यहाँ पर sympathetic chain का इसके साथ relation होगा. उसके अलावा iliolumbar ligament, obturator nerve, internal iliac artery की branches, they are all going to relate to this pelvic surface on the anterior side of the sacrum. So if you look at the pelvic surface, it faces antero-inferiorly, and it is vertical and it is transversely concave. So it is concave in the vertical sense as well and concave on the transverse extent as well. So here you can see these are the 4 pairs of sacral foramina which are present on the anterior surfaces. As you can see, it is a remnant of or let's just say a derivative of this side being the transverse process of each sacral unit and them fusing with each other and leading to this space in between. Now these sacral foramina are the site where sacral nerves are going to leave the vertebral canal and enter into the pelvic cavity. So at the level of the first sacral foramina, there is a large area between the right and the left foramina, and the sacral bodies are here, and these transverse ridges can tell you the demarcation between the individual sacral units. So the first 3 sacral ventral rami are going to emerge from these foramina, and they are going to pass anterior to the piriformis. If you remember the piriformis muscle, it is going to be attached here under the first sacral foramina in an E-shaped attachment. You must remember it from your lower limb. So yeah, first 3 sacral ventral rami are going to emerge and travel anterior to the piriformis. The sympathetic trunk, they are going to descend in contact with the bone, medial to both these foramina, and the lateral sacral vessels are also related to the bone. So there are 2 sets of vessels, lateral sacral vessels and the medial sacral vessels, and all of them are going to descend down in relation to the pelvic surface of the sacrum. More important, so the other important relations to the pelvic surface of the sacrum, they are the rectum, attachment of the sigmoid mesocolon, and reflection of the peritoneum to almost the level of S1 to S2 on the impressions of sacrum on the pelvic surface of the sacrum. So on the dorsal aspect, so dorsal aspect can be divided into posterior superior part and posterior inferior part. So you can see a lot of elevations on the posterior part of the sacrum. So let's see them one by one. It is quite understandable that these are the remnants of transverse processes. So you can count them 1, 2, 3 and 4. So these 4 ridges are the remnants of the fused transverse processes. So they form median sacral ridge. Just lateral to that, you will see the sacral foramina. If this is the sacral canal, if I enter a probe inside and face it anteriorly, it emerges in the sacral foramina on the anterior aspect, and when projecting it posteriorly, this is where my probe can be seen. So this is the vertebral canal extending backwards. So this is called, this central spinous process region is called as the median sacral ridge. Lateral to it are the dorsal sacral foramina, and the ridge lateral to the foramina is called as the lateral sacral ridge. This is called as the lateral sacral ridge, and these are the transverse processes forming the median sacral ridge, which ends in this. This is called as the cornua. So these 2 cornua present side to side open near the inferior sacral foramen, from where the last fibers are going to emerge and leave. So these 2 bifid processes are called as the cornua. So this is the median sacral ridge, lateral sacral ridges, and the cornua. Lateral to the lateral sacral ridge comes the lateral surface of the sacrum. It can be divided into 2 parts. First of all is this ear-shaped auricular part, and the rest of the lateral surface is going to give rise to all these depressions and roughened areas that you see on the lateral side. This auricular part is the articular part which forms the sacropelvic joint, where the sacrum is going to join to the hip bones and give rise to the formation of pelvis. So ye part you can see is a joint forming part. So this is called as the auricle. and the rest of it is the lateral surface of the sacrum. It is going to have a lot of attachments which we are going to discuss. But first of all, let's just see the apex of the sacrum. So this apex of the sacrum is the inferior aspect, and this is going to join to the coccyx. And this is the sacral canal, starting here and ending here and roughly triangular in shape. Now coming to, so the attachment of the sacrum on the anterior side or on the pelvic surface. First of all, near the ala, you have the attachment of the muscle called as iliacus. You have studied that in the lower limb. So psoas major coming down from the abdomen and iliacus starting from here, all of them are going to attach to the lesser trochanter of femur. So this is the area where the iliacus is attached. Other than that, as I've just told you, that under the first sacral foramen, there is an E-shaped attachment of the piriformis muscle. So you're going to have the piriformis muscle attaching here. On the dorsal surface, we have some important attachment. Just like you have seen that between the transverse process and the spinous process, at the level of thoracic and lumbar vertebra, the erectus spinae were attached. The same pattern is present here as well. So the aponeurosis of erectus spinae attaches to the tips of these posterior spinous processes and the lateral sacral ridge, and in between that, the erectus spinae, especially the multifidus group of erectus spinae, are going to be attached. Other than that, one very important muscular attachment is near the lower two sacral foramina. Lateral to them, you have the attachment of gluteus maximus on both the sides. You have learnt various points of attachment of gluteus maximus. One of them was sacrum, and at the lower part of the sacrum, this is where you're going to have their attachments. Other than that, these depressions, which were just medial to the auricular process of the sacrum, these important ridges are always very confusing to the students. You should always remember that you have studied about sacrospinous and sacrotuberous ligament while you were doing the lower limb. So yes, these sites lateral to the lateral sacral ridge presenting with these depressions are the site of attachment for all those important ligaments. So starting from the sacrotuberous ligaments, and you have the attachments of interosseous sacroiliac ligaments and the sacrospinous ligaments. They are attached in this area lateral to the lateral sacral ridge. Another thing to note about sacrum is that this is one of the bones which shows sexual dimorphism. How? The shape of the sacrum being slanting downwards in a uniform edge is one of the very female pelvis features. When you will be taught about the sacral indices and the sacral features, which while you are taught about the bony pelvis, then you would know the features of how sacrum in males and females are different. So as the female pelvis has to modify as per the needs of the childbearing, so the sacrum presents with a smooth profile, less angulation at the distal end, and the sacral index, wherever you have to study a bone, many bone present with something called as indices, where the length and the breadth of a bone are a ratio of the length and the breadth is taken. That thing is called as index. So the sacrum are more triangular, broader and shorter in case of females when compared to the male. This part will be dealt with while teaching you the bony pelvis. Right now, just remember a fact that this is a very important bone for sexual dimorphism and establishment of gender in case of skeletal remains. So just a quick recap. This is the S1 vertebra, the base of the sacrum. This is the ala of the sacrum. This is the promontory. These are the sacral foramina. This is the pelvic surface. This is the dorsal surface. It is roughly triangular. There is no difficulty in orienting it properly while trying to determine its anatomical position. And rest of the part about its sexual dimorphism will be dealt with while comparing the bony pelvises. Thank you.